6 years ago, the two brothers, Anant and Arun, were engulfed in their construction business. While also grappling with Arun's illness, till a life-altering incident changed their fate, and that of thousands of others from the villages of West Bengal.
My brother, who expired 2 months back, he was suffering of cancer. He used to come to Mayapur quite regularly. So one of the trip he met a lady who was an old lady, and he offered her a 10 rupees note as a thing. So she said, "Don't give me money, I am suffering from cataract. If you can arrange free surgery for me, I'll be obliged." So he arranged the free surgery for the lady. After 2 months, when he came back again, so that lady came back and gave him a rupees 10 note. So he said, "Why are you giving me?" He did not recognize that lady. He said, "Ki I am a beggar. I begged this 10 rupees from ISKCON temple, and I brought this money to you for you to eat sweets." And that 10 rupees inspired us to close down our business and start this venture.
Drawing a close to the construction business in November 2007, the two brothers would make their foray onto a path less trodden, dedicating themselves to the eradication of the lack of medical facilities in rural India.
People should understand the value of giving, the joy of giving. Everybody spends for his own clothes, for his own travel, or for his luxury. Even 1% of that is kept aside for the joy of giving, for giving. That 1% will give them the immense joy which they might not have got from spending that balance 99%.
Turning the urge to help into action, Arun and Anant Nivatya would open their first healthcare center in Mayapur, in the Nadia district of West Bengal. A center equipped with a general practitioner, a dentist, an eye specialist, and all the medicines needed to cure a range of ailments. All of which was provided free of cost.
When we started Mayapur, it was like a mela. People used to queue up 3 AM in the morning in the winter in Mayapur, and the queue used to be around, say, 500 meters long. So we did not know how to manage this queue. So we started a token system for the patients coming from the distance far. They will come into that, they used to hire a mini truck or like that, 100-150 people used to come from a locality or a village. One day in Mayapur we have seen more than 1,000 patients. It may be more than in any public hospital in West Bengal.
The enormous impact of this first small step would encourage many of their friends to join them and start a public trust called Rural Healthcare Foundation. And soon the Nivatya brothers would start opening healthcare centers in a number of villages across West Bengal, leaving no stone unturned in their effort to make medical care accessible to the rural poor.
খুব ভালো হয়েছে, লোকে হয়েছে, খুব ভালো হয়েছে। যাবো, একটু কষ্ট, পয়সা কম লাগছে, কষ্ট হলে তাকে হলে একটু কষ্ট করে যাবো। হাঁটতে তো হয়েছে না, গাড়ি ঘোড়ায় আসছে, ট্রেনে আসছে, আমরা ট্রেনে আসি, এসে আবার এখানে লঞ্চের ভাড়া করে চলে আসি।
13-14 কিলোমিটারের ভিতরে কোনো ক্লিনিক নেই। এইখানে কিভাবে সুবিধা হয়েছে, আমাদের ওইখানকার একটা লোক এখানে ট্রিটমেন্ট হয়, সে দীর্ঘ 4-5 বছর ধরে ট্রিটমেন্ট হয়। সে আমাকে বললো নারকেলডাঙ্গা গেলে, আমার বন্ধু আর কি, যে তোর সুবিধা হবে, তো এখানে যা অল্প পয়সায় ভালো ট্রিটমেন্ট।
Opening a new center every year in the various districts of West Bengal. Rural Healthcare Foundation over the last 4 years has provided medical care to over 15 lakh people at a meager amount of 50 rupees.
One has to be honest in delivery, and we have proved that at such a lower cost of 50 rupees, which is less than $1 today, we can have a sustainable model, and which can run for last 6 years it is running. Not only one center, another 5 centers we are running, and our model is more or less a sustainable model.
It's so gratifying, it's so satisfying to see the number of patients we are able to serve, the number of people who actually need medical facilities but it is unavailable to them, to reach out to them, the pleasure on their face, the blessings that they give us. We open as many centers as we can and serve as many people as we can.
After bravely battling with cancer for several years, Arun Nivatia today is no more. But it is his brother, confidant and partner Anant, along with the Nivatia family, working relentlessly to turn their dream into a reality.